Hello, everybody. As you can see, I'm now back in the office, which is interesting because you hit the rush hour commute, which is always fun. So welcome to our latest ARC Northwest Coast ARCFEST. For those of you who don't know me, my name is Professor Mark Gabbay, and I have the privilege and the honor of being the ARC Northwest Coast Director. Regular attendees to the ARCFEST, excuse me, will know that already, but we always have new public advisors, ARC members, organization staff, and other stakeholders joining us at our 3 monthly ARCFEST, so a warm welcome to you all. As always, I need to start with some housekeeping rules. This meeting is being recorded, and attendees and speakers may appear on the screen during sessions. However, if you still feel uncomfortable about that, you can turn your video off. Although we would actively encourage you to all keep your camera on to ensure sessions feel inclusive, especially during the theme discussions so that you can see each other. Also, please remember to stay on mute unless you're speaking, as this reduces the risk of background noise such as conversations with pets, spouses or children, or 100 people listening into that phone call. Please do make use of the chat function for questions and answers during both combined and later individual theme sessions. Staff are monitoring these, and we will endeavour to pick up these things put on the chat live and respond either in the chat or during the presentation where we can. If your comment isn't answered for any reason today, we will take the details and one of the team will get back to you as soon as we find the answer that you want. Unless it's about what's the meaning of life, the universe and everything, and then like you, we may struggle to find the exact answer for that one. As people are talking throughout the ARC, staff will be adding links to websites or documents to complement what's being discussed here. Rather than clicking on those links then and there, which may dump you out of the ARCFEST and you wouldn't want that, please cut and paste it onto a new window and look at it afterwards. If you miss any of these links, then please use our email address to contact us. So you shouldn't have to move away from this feed loop platform in any way during the ARCFEST. Please remain in this current platform and email the help desk should you have any technical queries. If you need any technical support during the event, one of my colleagues will post an email in the chat now with a phone number, and please keep this handy during the day in case you have any problems. There's a couple of important updates I wanted to provide you with before we start. After today's events, we'll be sending out a survey request for you to input on your preferences for the next ARCFEST that are coming up. Due to timing and the requirement to book venues in advance, we're proposing this will be our last ARCFEST, which is entirely virtual. We're currently booking venues around the region, which will facilitate hybrid events for our next ARCFEST during the remainder of this year. This will allow people to attend our events either live at the venue or access remotely during these ARCFESTs, either at home or from work, using a virtual platform like this. We do encourage people to attend face-to-face venues, as we feel this is an essential part of the mechanics of our collaboration, those coffee discussions, etc., that allow people to feel part of a team and to have those engagements. We will be encouraging mask wearing, hand hygiene, etc., and sensible distancing, as we do on our university campuses and workplaces whenever we can at the moment. Our progress as a collaboration has been somewhat blunted by the pandemic and its subsequent pressure it's put on our members, but we believe the need to get back to human interaction is critical for all elements of the ARC to return to it delivering for all. The ARC collaboration is its members, all of our members working in tandem with each other. Nothing else will produce the outcomes we need unless we believe we return to face-to-face for at least some of our meetings, as being part of a hybrid approach, so that our engagement together has that active sense of moving forward. but we will be allowing both options for all of our key meetings, where we will have people attending online and in person. Although many meetings will carry on as being virtual entirely. Although sometimes those virtual meetings will have a group of staff in a room together at the workplace, whether it's here or one of your organizations, and we will meet virtually across that distance to both the different people in the rooms and people joining us from elsewhere. The next ARCFEST, therefore, is planned for a hybrid format and will take place on the 21st of June. And we provisionally booked the Florey in Liverpool, which is a community hub, which also hosts a food bank. By using this venue, we're also helping, we believe, fund the community facilities and enable those deprived communities living in that area, such as Toxteth, to benefit from that economic support we will provide by supporting the community venue. But I must forewarn those of you planning on attending face-to-face that there isn't much parking around the facility, so we would encourage you to use public transport wherever possible, or taxi share from the station or the bus station or whatever. So we're going to use the findings from our member advisor survey to help us shape what these future hybrid events will look like. But we'll also be integrating a session on learning healthcare systems on that afternoon, which is something to look forward to, and more about that in the coming months. For today's ARCFEST, we're taking a different approach to keeping you updated about our progress. As we come out of the pandemic and roll back our own COVID work, we're increasingly emphasizing a wider ARC Northwest Coast portfolio of activities, albeit flexed to the new realities of the pandemic and the post-pandemic world. Despite the pandemic slowing our progress, we've initiated new formats within which we can make quicker, sharper impacts that facilitate collaboration between advisors, members, and academics so that we can deliver to all stakeholders. These emphasize co-production and collaboration, and that's what today is about. What we have termed connected research communities to summarize the aim and the process. Although, of course, in some of these meetings, implementation is the substitute for the word research as the focus of what we're doing. Today, we'll be hearing from a number of our research development networks, 3 in fact. These bring together not just our members, but also wider stakeholders to focus on tackling key prioritized issues such as digital healthcare, social prescribing, social and community mental health, and community mental health, and also well-being and health in the seaside, town and communities, as well as looking at health inequalities in those areas. And in fact, that last group is a pilot for a national group that we have around coastal health to see how, as ARCs, we can set up local groups that can then feed into a national agenda. These research development networks are the engines for new proposals and grant applications from within our themes. As you know, we have ways that we respond to suggestions from our members, but this is about the themes themselves, setting up groups, bringing our members in, but driving a prioritized research process from within. We hope our presentations today about the work of these connected research communities will give you a flavor of what we're doing, and would urge you to consider how these relate to the services you provide or your individual interests. Encourage yourself or a colleague to please join in these meetings wherever you can make a contribution, or just to find out what's being planned. We welcome wide views and collaborations, as you know. So please do nominate someone to get involved in these networks that you hear about today, as the more members of the collaboration that join these groups, the more power they will have to influence and make impact on what we're doing together. They can also generate the knowledge across the patch of what we're doing in the ARC. And it avoids the excuse of not knowing what other areas or organizations are doing in a specific area of interest. These groups, remember, are also open to non-ARC members, many of them, so they enable you to engage with third sector groups or other hard-to-reach groups about the topics that are interesting you. They create a hub of intelligence to share information on funding calls, priority areas for that subject, and also in any organizational research portfolio. So wherever you're working, what are we doing in the ARC that's relevant to your priorities? So these networks, parts of our connected research communities, which is the umbrella term that we're using in ARC Northwest Coast, we've created these to support our member organizations and public advisors with their research implementation ideas and projects to come together with academics in the same space and talk about what we're doing and how we can do them, what research we can do, how we can implement research, how we can share that intelligence, that expertise. In addition to the research development networks, we offer other connected research communities, such as specialist roundtables in areas such as stroke and mental health, the Seldom Heard Voices Forum, the Dementia Network, the Beneficial Changes Network, collaborative information groups, and the community research and engagement networks called CORANs. And you'll be hearing about these today as we go along. Now, just bear with me for a second, because I have to do a bit of messing about to find an image. So this is what connected research communities are. They draw on the principles of social network theory. They bring together all our key stakeholders, professionals, the public, academics, that need to work together to deliver an initiative, creating opportunities or spaces for these stakeholders to discover and learn from each other and to mobilize knowledge. We talk about knowledge mobilization a lot in how we share between large groups like this are what we know, how we understand, our interpretations of what is needed and what the solutions and challenges are. So by bringing together individuals that are connected to organizations or communities or special interest groups, we create bridges with the potential to bring and share ideas, information and solutions, ensuring that the network for initiative is engaged and enduring. These platforms are designed to facilitate the synchronization between our members on key issues moving forwards. It's important for you to note that we are evaluating these actively, and this will involve us looking at who is involved and what is their sphere of influence, how they contribute to the delivery of our ARC objectives, how we can observe changes and beneficial impacts over time from these networks and how they influence what we're doing and what happens, and what learning points and challenges we get from this system. And this evaluation will inform our plans and going forward and look at how we can make this type of model more sustainable and how we can recommend using this model for others beyond the life of this ARC. As you can see, as I was talking, as I'm circling around with my arrow, these are the different types of connected research communities that we'll be hearing about as we go through today. So just going to move on to a few other updates for you briefly. For Equity will be launched formally next week. This is a new web-based platform providing tools and resources to help make research evidence more relevant for action to reduce social and health inequalities. The For Equity web resource aims to support people to better integrate an equity lens throughout the research process, from identifying the research questions to study design, implementation, dissemination and knowledge exchange. It has a strong focus on how involving people with lived experience and policy or practice expertise will help strengthen the equity focus of research. And this was something that we developed jointly between ourselves and the Northwest Coast ARC and the School for Primary Healthcare, which the NIHR also runs, and we have branches of in the Northwest Coast. It will be adopted by us to update our use of the Health Inequalities Assessment Toolkit, which we use, as you know, throughout our work. And this has been expanded and updated, and the link from the Hyatt will now go to the new For Equity website, which has a load more additional resources. So it's really great, and please do come along to that launch next week. Sometimes it's important to remember the impact which the investment in both the Clark and the ARC has made, not just in their immediacy, but for many years afterwards. So it's very pleasing to read this month that the NIHR has awarded $2.5 million for a project to develop technology to improve kidney health in people living with heart failure. The seeds of this work were originally planned in a PhD student's work funded by the Clark Northwest Coast, and has now led to this study funded for £2.5 million, which will predict how often each person with heart failure needs a kidney test to help save their life and reduce their risk to their health going forwards and improve their health living with heart failure. And some of our staff will be working on this collaboration with several of our members across the Mersey region involved, and it's something for us to be proud of. We'll be adding a link into the chat to help you find out more information if you're interested in this work. During the ARCFEST, if you want to be with us on our Twitter hashtag, it's @ARC_Northwest Coast, or NWC, I should say, and this will be put in the chat. I don't know about anybody else, but my chat seems to be blank, but that might be because I'm on Zoom. And you can also use the hashtag crosshatch ARCFEST in capitals 22, which we will be using for our ARCFEST all throughout the year. So no more ramblings from me, and huge apologies for the struggle to find that slide. But now we're going to start with an insight into one of our collaborative implementation groups that will start the session now, and that's called the Impact Mental Health Roundtable. So over to you, Catherine.